I'm a senior project manager with the Indianapolis suburban region. I work for all 4 hospitals, but right now I'm stationed out of IU Health Saxony, soon to be IU Health Fishers. So during this round of Expansion City, we are working up the med-surg, cardiology procedure room, emergency department, imaging, and with a special focus on mammography, and really looking at the room layouts, the inner workings of the room, make sure the flow, the patient flow, the team member flow, all works within the design space and making adjustments as needed. It is ground up construction, so we start with a blank parking lot, we put up a circus tent, and then we start putting metal frames and plastic sheeting up. All of that happens after the design team gives us the specifications for each of the rooms. So they come with the floor plans, the layouts, where the doors go, where the hallways are, all of that kind of information. We build it to spec, and then we actually hang stuff on the walls like the one behind me. You can see the head wall fitted out on the plastic sheeting. We bring in all the medical equipment, all the furniture, all of that has to be to scale, or as close to scale as we can, because if we're wrong now, it's an adjustment. If we're wrong after we get it built, it doesn't serve the team members, it doesn't serve the patients, and it ends up costing us a whole lot of time and money. If you're not here and you're not present and making sure that we hear your voice and your concerns, we don't know to incorporate them. So be present, make sure you're empowering the team, make sure their voice is heard.
Just kind of looking to see entrances for patients, beds, holding areas, safety zones, that kind of thing.
I think it's important for all units to have attention and to really sort out the details of all units so we can provide the best patient experience to our patients in the city here at Fishers. We're doubling the size of our med-surg unit, so we're going from 32 beds to 64 beds. So that's exciting, and so we're really focused on, does the room have what the patient needs, what the family needs, and what the nurses need to really provide exceptional care for the patient. Each population we serve has a different need, right? They come to us for different needs. We want to be sure each area and each room provides what those patient needs. If it's a pregnant mother, her needs are different than a grandma that's 86 and has dementia and maybe in hospice and hospice care. Their needs are different. So really the lens we're looking for is, do these rooms provide what they need for the population that they're serving?
All right, I'm gonna do Stitch. So I'm Marty Cox, and I'm the Service Line Director for Women's Health in the Indianapolis suburban region.
Karen Gallagher, OBGYN Physician Lead for the Indianapolis suburban region of the ISR.
Today we're looking at what that OB experience looks like from both the patient, the staff experience, and the physician experience.
I think this has kind of been the next phase of the ongoing project. It's really exciting to see something tangible. I think the design phase and the planning phase has been going on for a number of months, and so to get to this point when we can actually see something physical is pretty exciting. Yeah.
We have actually gotten team members from different hospitals that don't work at Saxony, since we don't have OB here, and we've gotten people from every job description. So PCA, unit secretary, nurses, surgical techs, physicians. We've just gotten a lot of different people who've been willing to participate in this event, and they're really having a great time. Right. I think they're really excited because even though they're not going to work here, the idea of being able to plan for their colleagues in the future to be able to live in this space and work in this space, I think they're super excited to have that opportunity.
Also really exciting for them to put their own fingerprint, if you will, to quote Chad, to put their own mark on the facility going forward. Again, they may not all be here, but I think there's so much value to the experience we have within the system. So to be able to build on that moving into this new facility and this new space is going to be amazing.
And it's been a real big learning for me as well. Just oh yeah, you need to think about that, and how do all these things interact, and what is it like to build a brand new building with a brand new facility or brand new specialty.
Elsie's got her second baby. All right, and push.